Welcome to ToothBrothers. You found another episode where we talk to you about teeth, dentistry, in the dental office. I'm Dr. Scott.
I'm Dr. Kevin.
And today we're talking about xerostomia.
What's that? Hey, Dr. Scott, what's xerostomia?
Xerostomia, dry mouth, cotton mouth. No more spit, no more saliva. Your mouth is dry. What are some issues with that? What causes it? What can we do about that? Well, first of all, as dentists, we are worried about dry mouth. Dry mouth can lead to tooth decay and gum disease. How does that do that? Well, the main reason why it does that is that there is no saliva, and saliva is the most protective factor against tooth decay and oral health and plaque buildup.
Saliva actually has a flow pattern as it goes through the mouth. It actually does wash away food debris, it washes away plaque and bacteria.
Yeah, so what are some causes of dry mouth? Xerostomia is the fancy word.
One of the most common ones that we see is actually medications. A reducing of the amount of salivary flow is something that's common with a lot of different medications. A number of them actually reduce that. So if you need those medications, you need them, but that also has that side effect. Something else that can cause it, stress and anxiety. Going into an important meeting or speaking in front of people or just going through traffic. Sometimes we can get sweaty palms and a dry mouth. Another one could be tobacco and alcohol use. Those things often do.
Caffeine.
Caffeine is another one, yeah. Those can reduce our salivary flow. Let's see. Another one is diseases. More common would probably be diabetes can actually reduce our amount of saliva that we have. Now, all those things can contribute to it. Some of those are reversible. Some of those are more of an irreversible long-term type of reduction in saliva.
Yeah, so what can we do to prevent dry mouth? What can we do to help our patients? What I normally do is, or recommend, is keep a bottle of water on you at all times. That's the best. Keep your mouth hydrated, keep the water coming. There is a product out there called Biotene. I've used it before and I think it works great. I don't struggle with dry mouth, but it really gets my saliva going. And I found that patients really enjoy it too. Biotene, and I can put it in the description down low and I'll put a picture of it on the screen here.
Yeah, it's like a mouthwash, mouth lubricant. So it comes in a little bottle like that sometimes, or you can get a larger size of it, but you just take a little swish and then spit, and it kind of has a lot longer of a lasting effect than just a sip of water would have. Now, the thing about dry mouth, a lot of people don't realize that they have it. In fact, you probably won't recognize you have it until you have more than 50% loss of your saliva. So it's something to consult with your physician and your dentist about to find out if that's something that is going on for you, if they see any signs of that.
And if you do have it, stay on top of your dental cleanings. If something's happening, we see a cavity, we can catch it early. We can, going forward, we can help educate you and saying, hey, these cavities are popping up. It's probably due to dry mouth. What can we do to help prevent this? So,
yeah, and the last thing, mouth breathing. We mentioned this in a previous quick bite, but mouth breathing is a major way that the saliva amount of flow that we do have is dried up quickly. So it's not so much that you're not making enough, it's just that you're drying it out too fast. It can be caused by a number of things. Some people think that wearing a mask, if they posture differently, they might breathe through their mouth more. Another thing that can cause it is by when we sleep, sometimes our mouth can come open, whether we can control it or not. There can be signs of an underlying sleep breathing problem, so consult your physician or dentist if you think that's going on with you.
Yep, we hope this information helps. Again, I know I say this a lot, but we are here to help provide information to help you guys, educate you guys on your oral health. If you like our video, please give us a thumbs up and subscribe. That will help us get our information out there and our message out there. And that's what we're here for. So thanks for watching, guys. We'll catch you next time.
See you next time.